Hey guys, Dr. Derry here today. I'm with Clara again to help me out, and so we're gonna go over lower back pain stretches that you can do in bed. So when we treat clients who have lower back pain, we often start with stretches in the bed because that tends to be a comfortable position. We like to lay in bed, head and neck is supported, and we can have our knees bent to give our back that nice level playing ground to start. And when people are looking for relief, sometimes they like to do it first thing in the morning to give themselves a nice head start to the day. So we're gonna go over 5 awesome lower back pain stretches that you could do at home to help you get some relief, and you could do them in bed. So let's go. And if you guys enjoy it, please subscribe to the channel. Okay, so we're gonna go over those 5 stretches now. And so when you're having lower back pain, sometimes it can be hard to even get out of bed, and you may be going through an acute spasm, or you feel like you just need to do a little something in bed to help you just get out of bed, and you're not able to get to those more aggressive stretches or strengthening exercises. So these are more foundational stretches to help you with that lower back pain that you can do in bed, that you can be well supported, and just listen to your body along the way. So as we go through this, not all of these may be for you, but just listen to your body. All of these should be pain relieving, and so you shouldn't feel worse afterwards. You should feel like you're heading in the right direction, and it's absolutely our intent to get you up and feeling better. None of these should make you feel worse. And so the ideal scenario is maybe if things aren't going well to speak to a physical therapist individually, but we have found that some of these do really well. So let's just go through them together. So the number one is going to be called a pelvic tilt. And so Clara here is going to just stay super relaxed, and you're going to see her make a little movement with her pelvis where she's going to go backwards. Right there, backwards, and then relax, backwards, and relax. And so what she's doing is just flattening her back to the bed or the table here, just to get a little bit of flexion and a little bit of movement in the spine. And so it is very foundational, not super hard, but it can be really helpful to help give you some movement into your back. And so this is called a pelvic tilt. Again, the dosage, or how often or how much to do, I'll put that in the description, but we typically start with a few more reps than you would think, maybe 20 or 30 or so, just to loosen things up, and that flexion moment can feel really, really good. And so she's gonna keep tilting back here and then relax. Awesome. So as she tilts back, she's kind of contracting her abdominals a little bit. And so she has great motor control and movement there because she has done this hundreds of times and taught many, many people how to do it. So don't feel bad if it's hard to do at first, because you've got to establish that connection from your brain to your back and hip and pelvis, because when you're in discomfort, that connection isn't quite as smooth. And so this can be really, really good. Awesome. Okay, so she's going to move right into what's called knees to chest. And so let's say you're in a lot of discomfort. She can do one leg at a time and just kind of pull that one leg to her chest. And so you can see that movement here. Again, she's getting a little bit of flattening in her lower back, and she's pulling her knee towards her chest. Now, what you can't see because of the angle is she's not directly like pulling up towards her body. She's kind of coming out a little bit and pulling up, and that's absolutely okay because that's just how her hips are built. And so she has a little bit of a stiff hip, and so she's just gonna come off to the side, so hopefully she can get a little bit of a pull in her lower back for some relief. Perfect form. I wouldn't expect anything less. Very good. She looks good. Great. So she's going to keep pulling that knee and hopefully get some relief with that. And then we're going to move on to what's called trunk rotations, so the lower half of our body, and she's going to rotate side to side. Again, the goal of these is to help improve range of motion and reduce discomfort. And so as she's going here, she's not going to focus on going as far as she possibly can. She's just going to focus on getting some mobility and relieving some discomfort and listening to her body. I think that's where some people go wrong sometimes, is they try to do more thinking more is better, where really we should just listen to our body. Every person is different, and if you're just getting some range of motion and rocking her knees side to side, you're getting some relief from it. Now, there is some variety. You can have your feet a little bit wider apart if you would like. That can be good as well, right? Some people have crazy mobile hips and they can go all the way to the ground. That's okay. You can have a little bit more bend up towards your buttock if you would like, or a little farther out. Guys, there's a lot of variety. Every human body is different, so just find what works for you. Feel good? Looks great. All right, so now we're gonna go into some stretching. So what we love to use for stretching is the strap here, and so it's a great nylon strap that is super stiff. It's not gonna break, it's not stretchy, and it helps us stretch our leg muscles, which we're gonna hit are the quads and the hamstrings. Now, I'll show both here where you do it with and without the strap, but the strap allows you to get a little bit more out of it, well worth the investment. And so she is going to wrap this around the arch of her foot. She's going to use her hands to stretch her hamstring here. And so she is going to pull and relax, pull and pull and relax, pull and relax. I'm not physically pulling it. So she's gonna pull and relax. So if you've got this strap next to your bed, you whip this out in the morning and you stretch yourself out. Good, she has great form, good hamstring stretch from the glutes to the back of the knee to help stretch the hamstring. Now, if she didn't have a strap, relax. She's just gonna grab behind her knee and she's gonna kick up towards the ceiling. Good. And you may not have full range of motion at first, right? You may stop here or even here, and as you kick, you just may listen to your body. That's exactly the whole point of all of this, just listen to your body. So those are some great stretches that you can do in bed. And for this last one, we're gonna keep the strap on her foot. She's gonna scoot towards the edge of her bed, and that leg is going to fall off the bed. And we're holding this leg up. All right, hold this leg up, and we're going to let that leg fall off. And the intention here is to feel the quad stretch. And so we've hit lower back, we've hit hips, and now we're hitting into our leg muscles, the hamstring and the quad. And so when she relaxes there, we're just kind of relying on gravity to kind of let her feel this stretch here. But if we have this strap, she can grab it with her other hand and pull that leg up so she can get a little bit of knee flexion. Yeah. You let that, you're gonna keep this strap loose, let this leg stay down, and then pull slightly. There we go. And so you're gonna feel that stretch in the front of your leg. And so what you saw her do at first is that her leg was up here, which that doesn't allow the quad to lengthen. So you need that to drop off. And that's why you need to be closer to the edge of your bed. Don't worry, just be at a little angle. You're not gonna fall off the bed, but of course be careful. And you know, if your bed isn't high enough and your foot's hitting the floor, there's other ways to get through it as well. So we're just gonna stretch there, and she should feel a good stretch in the front of her leg. And so those 5 stretches can help you get a great start to your day and just loosen things up in your hip and lower back. And maybe you're just having a bad day in your back and you just want to loosen things up and see how you go. Perfect. These are foundational. They may not be for you. All of them may not be for you, and that's okay. Just find 1 or 2 that work well. And if you guys like what we're putting out there, please subscribe to the channel, show some love. It'd be greatly appreciated. Leave any questions and comments in the comments section, and we'll get to them and help you through this. So as always, guys, stay healthy, keep moving, and take care of yourself.